So what are the changes occur in the hemodynamic during pregnancy? So physiology of endocrine system we already studied. So today we will discuss about the hemodynamic changes. So physiology of the pregnancy hemodynamics. So what about the plasma volume? The plasma volume increases by 10 to 15% at 6 to 12 weeks of gestation, expanded rapidly until 30 to 40 week. The total gain at term approximately 1100 till 1600 milliliter. Total plasma volume of 4700 to 5200 ml at 30 to 50% increases from the non-pregnant state. Acute excessive weight gain is commonly due to edema. So whenever the blood pressure increases, the blood volume increases, the pressure increases, so blood ooze out from the vessel and form edema. So what are the changes in RBCs? The RBC level increases from 1400 to 1640 milliliter a term, that is more than 18%. With iron and the folate supplementations, an increase of 30% has been reported. The discrepancy between the rate of the plasma volume and that of the red cell mass result in the relative hemodilution or physiological anemia, with the hemoglobin concentration, hematocrit, and Wbc count all decreases, particularly in the second course or second trimester. Mean corpuscular hemoglobin concentration remains the constant. Total Wbc count. Total Wbc count increases mainly due to increase in neutrophil polymorphonuclear leukocyte with the peak at 32 week. A further massive neutrophilia occur during labor. Eosinophil, basophil and monocyte remain relatively constant, but there is profound decrease in the eosinophil during labor, being virtually absent at delivery. Although lymphocyte count and the number of B and T lymphocyte remains constant, lymphocyte function and cell-mediated immunity are profoundly depressed, giving rise to lower resistance to the viral infections. Platelets. The platelet slightly decreases during pregnancy. Platelet function is unchanged. The clotting factor pregnancy is hypercoagulable state, so most clotting factor increases, especially fibrinogen. Erythrocyte sedimentation rate level can also be elevated up to 4-fold in pregnancy. So we see that during the pregnancy the volume increases, the blood pressure decreases. Why the blood pressure decreases? Because here the plasma volume is increasing, the RBC amount is increasing, some sort of WBC level is increasing, the platelet which slightly decrease, and lymphocyte they are normal or slightly decrease. So instead of all these the blood pressure decreases, okay, because you know what happened in this in pregnancy, the total peripheral resistance they start to decrease by the relaxation of the smooth muscle by the action of the progesterone. So whenever the blood vessel start to relax or the diameter increases and the dilation of the vessel occur, so the total peripheral resistance decreases. When the peripheral total resistance decreases, then the blood pressure definitely it will decrease. And the cardiac output increases, the stroke volume increases, so everything increases because the body metabolism is going high, and the high metabolism definitely need more amount of oxygen, more amount of nutrient in order to perform more function to facilitate the fetus.